I think one of the most important is just awareness about a lot of diseases and getting people to be aware of them, especially in the developing country context. There is very low awareness about a lot of diseases. There's also a lot of social stigma. Which makes the diagnosis and treatment of these diseases very difficult. And in fact, a lot of these diseases don't even get notified or reported to the health system for this reason. So that's one major challenge. The second is in affordable, accessible diagnostics. A lot of the diagnostics that are available are quite outdated or have been around for a very long time, and a lot of innovations have happened since then. But they haven't really reached out to people who need them at the scale that is needed in developing countries. So the cost of the newer diagnostics definitely needs to come down, as well as the ease of using those diagnostics. And I think the third is around the treatment. We definitely need drugs with better side effect profiles. A lot of the current drugs that are available, there is a fair amount of reactions that people have, which results in them stopping their treatment, and that has a lot of consequences for resistance and for a lot of other issues. So I think these are three, broadly speaking, major areas in which are facing healthcare today and which need to be addressed. I think one very major trend is access to healthcare related information that is definitely going up, and with the internet people are able to very easily access a lot of healthcare related information, which has its advantages but it also has risks, and that is something which will definitely need to be addressed, because sometimes it disrupts the patient doctor relationship or adds a lot of tensions to that. So I think that is a big trend in just access to information, which will be something that the future leaders would have to address. The second is, I think, the emergence of the drug resistant and the newer strains of many diseases which have been around for a very long time. We're seeing very rapid changes in these diseases. Tuberculosis is one example. So definitely the treatment regimens for these, the way they are diagnosed, the complexity is undergoing tremendous changes, and that is again a challenge for the future. The third one, I would say, is a dual burden of disease that a lot of countries and a lot of societies are facing, where they are still grappling with the infectious diseases like HIV, like TB, like malaria, but they also have a growing and significant burden of non-communicable diseases like diabetes, cancer, mental health. So for a long time, we're going to see an existence of both these, and being able to address that, manage that, treat that is a big challenge for the future. Yes, so there are a few reasons for the resurgence. One is that, and a major reason is that patients are not actually completing their treatment. So for drug-sensitive TB, drugs have been around for a very long time. It takes typically 6 to 9 months for a patient to be fully cured. But because of social stigma, because of a lack of awareness, as well as the side effects, and the inability to tolerate certain medications, a lot of patients are actually stopping treatment before the 6 to 9 months, which is giving rise to drug resistant strains. So that is a big problem that we are facing today. The second is that not enough people are coming forward and getting tested or getting diagnosed, and that is because there is a lot of concerns around TB. People with TB are considered very infectious and often isolated or discriminated against by other people in society, which makes it difficult for people to come forward and get diagnosed and treated. And the third is that the diagnosis of TB is still very complicated, it's very cumbersome. The traditional diagnostic methods of using a sputum culture, which takes several weeks in a laboratory, or using a chest x-ray, And there are newer diagnostics which are coming up, like the Gene Expert, but they are not accessible and affordable to all communities. So that is a big issue. And finally, on extrapulmonary TB, which is TB outside the lungs, diagnosis remains very complicated. So people can have TB of the hip, TB of the spine, but it's not easy to still diagnose that. Treatment is still pretty straightforward, but diagnosis is very complex. So these are some of the reasons why I think it's re-emerged as a major healthcare challenge in the world.